Hello, I'm Dr. Chris Chappel. I'm a board-certified family physician and certified medical director credentialed by AMDA. I'm also an adjunct professor in the Nova Southeastern University Physician Assistant Program. Practicing in a nursing home environment, I see and treat hundreds of patients with osteoarthritis, or OA. As you know, OA is a slowly progressing, painful disease that can affect most of the joints in the body. Although there is no cure for OA, we as healthcare practitioners aim to help manage pain in these patients and improve their quality of life. It may surprise you to learn that around 40% of OA patients are taking opioids for the treatment of pain. Although opioids can be appropriate for some patients, it is important to identify which patients may be able to minimize their pain in other ways. A stepwise approach to OA pain management allows us to maximize pain relief using the least harmful, addictive, and costly treatment first. This method should be familiar as we typically treat other disease states in a stepwise manner. After a patient assessment, non-pharmacologic options can be a great place to start treatment. Some options include weight loss, massage, and occupational therapy. We can also recommend the use of canes, walkers, or braces. I often refer patients to a chiropractor, acupuncturist, or physical therapist. These options can give my patients a more functional foundation to work from. Pharmacologic treatment of pain begins with the least potentially harmful medications. Prescription and/or over-the-counter non-opioid analgesics can be effective first-line options. These include acetaminophen and NSAIDs. Ensure that each patient's pain management plan is individualized. A patient's medical conditions and concomitant medications must be considered when determining an appropriate analgesic. Although exercise and physical therapy can be helpful for patients with OA, these activities can also result in breakthrough pain, even in otherwise well-controlled patients. By managing breakthrough pain on an as-needed basis, we can help patients remain active without escalating to stronger routine medication. Managing each patient's pain in this way can potentially reduce overall exposure to opioids. We may begin to consider prescribing opioids when other pharmacologic agents have been ineffective or are contraindicated. Begin with weaker opioids at the lowest possible dose before escalating to stronger opioid options if needed. Sometimes patients ask me directly for an opioid prescription. They may feel that their pain is too intense to be relieved by a non-opioid treatment, or that other medications have not worked for them. When my patients request a prescription for opioids, I consider it important to identify their motivation. I ask them what other medications they have already tried and what dose and frequency they were using. I try to determine if patients have any addictive behavior, such as smoking or alcoholism. I may also consider if there's a risk of diversion or a need for psychological evaluation. Additionally, I really stress a few key points when talking to patients. The goal of pain management is a response, not a resolution. So don't look for your pain going fully away. Look for your pain to be controllable so that you can do both what you need to do and what you want to do. Start with non-pharmacologic and over-the-counter non-opioid options. Carefully consider the risks, contraindications, and side effects of any medication you recommend. Use opioids only when appropriately indicated. By adopting this stepwise approach, we can help patients with OA safely manage their pain.